to all and everyone. First of all, I'm very thankful to Kendra Bank Retired Officers Association for this invitation to be amongst you this evening. And we have Chief Guest Sri S.K. Majumdar, Executive Director, Kendra Bank, Sri K.V. Ramanmurthy, Ravi Kumar, Acharya, Sudhakar Shetty, Vijay Kumar, Hande, Krishnamurthy, Jagdish, and a host of officials and retired officials and executives and ladies and gentlemen. In fact, it's a matter of pride and privilege to be amongst you this evening. Just before starting my lecture, of course, it's a pan-India organization and a pan-India presence. So still, I will start with a couple of my own mother tongue words. ಮನಸ್ಸು ನಿರ್ಮಲವಾಗಿದ್ದರೆ ಸಾಕ್ಷಾತ್ಕಾರ, ಮಾತು ಮೃದುವಾಗಿದ್ದರೆ ಚಮತ್ಕಾರ, ನಡೆ ನುಡಿ ಚೆನ್ನಾಗಿದ್ದರೆ ಪುರಸ್ಕಾರ. ಇದನ್ನೆಲ್ಲ ಮೈಗೂಡಿಸಿಕೊಂಡಿರತಕ್ಕಂಥ ತಮ್ಮೆಲ್ಲರಿಗೂ ನನ್ನ ನಮಸ್ಕಾರ. When I walked into this auditorium, I never thought, looking at most of you, it is a retired official association. I thought it is a regenerated officials association. See, age is just a number. If you have dreams to live, if you have dreams to work, you are still continue to be young. And I am seeing, this is what, when India got independence, average lifespan of Indians was 37 years. Now it is around 71 to 72 years, and it's almost touching 74 years in southern India and about 72 years northern India. Why I am emphasizing this lifespan? Because our retirement age at this point of time is 60 years, because you have all retired at 60 years. Because the average lifespan of Indians is going beyond 70 years, time has come to revise the retirement age. Time has come to revise the retirement age, and in my opinion, retirement age should be fixed somewhere around 62 to 65 years. So that's what. See, because another important, there's a very popular saying, a healthy nation is a wealthy nation. And I have been associated with Kendra Bank since 2005, 2006, when I became the director of Sri Jayadeva Institute of Cardiovascular Sciences in Bengaluru. At that time, there was just an extension counter of Kendra Bank. At that time, institution was small. It has just 250 beds. Then during my tenure of 18 years, this institution's bed strength increased from 300 to 2,000 cardiac beds and makes it one of the, and this is the largest public sector heart care center in Southeast Asia. And parallelly, the extension counter of Kendra Bank became a branch, and in fact the transaction became so much. The so-called in the neighborhood of Bangalore, other branches were really little bit worried, because earlier it was an extension branch, now it has become a branch, and because of the huge transaction that was taking place in our institute, others were a little bit jittery about that. That's it apart. So today, Kendra Bank is one among the top first 10 ranking banks. It's one among the first 10. It's all because of your efforts, your commitment, and your dedication. So I'm proud to say Kendra Bank is known for hospitality. Kendra Bank is known for trust, and also for public trust is very important. Because for two things, people come to the hospital or to the bank for two things. One is if there is a good reception, if there is a good hospitality, and the trust factor. So hence, I am very happy. In fact, you are all lucky to have worked as Kendra Bank employees, and I was told your executive director S.K. Majumdar doesn't have any enemies. Ajata Shatru. I think most of the executive directors and most of you are Ajata Shatru. That is the reason you are all smiling and your health is good. That is one of the important things. See what India is not a system driven country. India is an individual driven country because if some individuals are good during their tenure or during their term, the institution blossoms, institution grows, and of course, there are two ways of looking at. We always head of the organization or head of the institutes, we call them as boss. What is the definition of boss? What is, in my opinion, bosses are those who trouble others. And Kendra Bank never had bosses, they all had leaders. So leaders are the one who inspires, who motivates. So despite global turbulences, despite global challenges, India is marching towards becoming the third largest economy by 2027, and your contribution in banking sector and also making India financially resilient and vibrant, your contribution is also really appreciated, and your role in nation building is also very much appreciable. Because the way things are happening, of course, we are facing a very tough times now. After COVID, we are already into this 22nd day of Gulf War. The war is not just between Iran, United States, or Israel. War is becoming global. It is becoming a chemical war because oil wells are burned, bombed, then the gas hubs were burnt and bombed. As a result, it is a war against climate, it's a war against environment, and probably it is going to have a huge economic impact and also on an impact on all essential commodities. Anyway, hopefully some wisdom prevails upon those things. We'll try to see what happens next. So, going back to this age factor, what is the definition of, nowadays we call anybody above 60 is senior citizens. I don't think 60 and above, just 60 plus is senior citizen. The definitions have really changed actually. Between 60 to 70, it is called young old. Between 70 to 80, it is old, and more than 80 it's a grand old. So most of you fall into the categories of young old. That is the definition of these things. See, priorities keep changing always. For every 10 years of our life cycle, priorities keep changing, expectations keep changing. First 10 years of life, we always ask about age. What is the age of your child? 4 years, 5 years, 6 years? Then 10 to 20 years, then we talk about marks. How many marks your child has scored? Then 20 to 30, we talk about salary. How much is your salary? How much is your salary? 30 to 50, then we keep talking about our earnings. How much is your earning? 30 to 50. 50 to 60, then we talk about what is your blood pressure, what is your blood sugar, what is your blood pressure, what is your blood sugar. Then 60 to 70, then we talk about pensions. How much is your pension? Is pension exempted from income tax? Is pension exempted from GST? Then again after 70 years, we come back to the same age. If we see a very old people or old man, aged people, are you 80 years, sir? How is your Are you 90 years or Ravi Surat? This is a life cycle that keeps changing. For every 10 years, the priority changes. It is the effort, the focus, and the consistency is the one which separates between dreamers and achievers. So it is the consistency, because India by 2047 we are dreaming actually and hoping will become a developed nation by 2047 despite global turbulences. So look at the GDP. According to World Bank assessment, GDP is 6.4, 6.5. I hope so. This war effect should not disturb this. And the fiscal deficit is 4.4. Is well kept by our Honorable Prime Minister and the Finance Minister. So this is just to highlight. And I think our life is all about ABCD. Life is all about ABCD. For children, ABCD is different. For older people, ABCD is different. What is that ABCD for children? A stands for Android, phone. B stands for Bluetooth. C for computer. D for dance. Then you take the same analogy to ABCD of the elderly people. A for arthritis. B for blood pressure. C for cholesterol. D for diabetes. This is how the life cycle goes on. But most important is, yes, we always say the time has changed. Time has changed. No, time has not changed actually. People have changed. People expectations have changed. See, sun is very much there itself, and moon is there itself. We still have, the sweetness of mango is still there. Bitterness of neem is still there. Only people have changed. The expectations have changed. See, we try to actually assess the beauty of a person by their color and complexion. We try to assess the educational standard by marks. And we try to give respect based on money and their position. See, this is an era of income idre welcome. This is an era of, if there is an income, then you are most welcome. People ask, if you have money, they ask, how are you, sir? If you don't have money, then they ask, who are you? So this is the stage we are in. That is one of the important things I wanted. See, again, going back to, I think, what is life? Ultimately, we have to come to that. Because I am extremely happy that Kendra Bank has got a workforce of nearly 80,000 and 40,000 are below 40 years. So it is one of the youngest banks in India, and youngest bank in terms of age. In terms of age of the workforce, it is the youngest bank. But as far as achievement is concerned, it is one of the biggest bank as far as achievement. So you have to actually, you should respect the world when you are young. You should respect the world when you are young. And help the weak when you are strong. And confess the fault when you are wrong. One day you will be old. One day you will be weak. One day you will be wrong. Which is because in my opinion, today we are searching for happiness. We want to be happy, but system, surroundings, circumstances will not allow you to be happy. That is one of the problems. Why this is happening? Because actually, who is a rich person? Is the person who is having lots of money is the rich person? Person who is having a lot of bank balance is the rich person? No, in my opinion, rich person is the one who gets sleep moment he gets onto the bed. Moment he gets onto the bed. And rich person is those who talks good about your colleagues, who talks good about you behind your back. So he is the one. and talking to each other is more important than talking about others. So they are the rich people actually. Talking to each other than talking about others is this thing. So I think this is where why people are not happy nowadays. Of course, world is moving very fast. People are not happy because people think others are more happier than us. That may be the one of the reason why most of the people, because we don't appreciate what we have. We always think about what we do not have. If you are actually having a two-wheeler, so you are always looking at a four-wheeler, oh, I don't have four-wheeler. Then you are having a four-wheeler, then you are looking at some other branded cars, so which I don't have. That's what once Shakespeare says. His son actually wants to have a branded shoes. Shakespeare tells his son, you look at somebody in the street, you show one person, he doesn't have one leg, but you are asking for a branded this thing. So God has blessed you with a good health means you are the richest person. If somebody has got a good health, he is the richest person. That's what one has to appreciate. So yes, because always in our system, that is our Indian custom actually. I have worked very hard. I have suffered a lot in my life. So my children, my grandchildren should not suffer the way we have suffered. Because of your hard work, because of your efforts, you have come up in life. But we feel, no, our children should not suffer so much. So we try to make more property. We try to keep more bank balance for them. So in my opinion, if parents have lived up to 75 years without any diseases, that is the best genetic balance sheet they are passing on to the children. That is the best genetic balance sheet. That's what, because always nowadays this generation children ask their parents how much property you have made in my name, how much bank transfer has taken place. So I think your answer should be, we have lived up to, we are certainly the way, the brightness I am seeing all of you, the smile, the spark I am seeing on your face, certainly all of you will live for 100 years. Certainly that is the level of this thing for hope. So that is this thing. So I think another important thing I wanted to emphasize, friendship. There are many studies. Those people who have got very good friends, there are three types of friends: good friends, better friends, and trusted friends. If you have a trusted friends, because friendship has got lot of bearing on your longevity, and all the more the importance of friendship comes after retirement. There are some people when they are in office, when they are in working age group, they say, no, I don't have much time, then they will not make any friends. After retirement, they try to search for friends, they are not there. Because if you have a real concern, if you are really a hard-working person, if you are really a concerned person, you will always find an extra time for your friend or for your colleagues. If you always have an extra minute for that. So there are many studies which have shown those who have got good friends, their lifespan increases by 10 years. I'm very happy to see nearly 2,000 friends here. So this itself will going to increase your lifespan by 10 years. This is a great thing that is happening. Because friends are like heartbeats. They are invisible. Friendship is like an heartbeat. It is invisible, but it continues to support your life throughout your lifespan. That is the importance of friendship. So that's a very popular saying, coming together is the beginning, keeping together is progress, and working together is success. So that is the story of actually the Kendra Bank. So and at the same time, see, of course, bank means we always talk about currency, we talk about coins and all. in my opinion, money is a small coin. Love is a lovely coin. A relationship is a sweet coin. And health is the gold coin. So health is the gold coin. So this is where we have to give more importance to health. And who is your companion? Who is your partner? Is your partner is your wife? His partner is your husband, children? No. Your partner is your body. Because we have seen all these things during COVID. Partners were running away from each other. Relatives were running away from each other. So I think because your permanent address is your body, it is your responsibility to take care of your body. It's very, very important. Yes, actually, I was trying to know more about S.K. Majumdar because you all tell. Because institutions can grow when you start supporting each other. And you should always provide space for others to grow. When you provide space for others to grow, without your own knowledge, you are growing actually. Because weak-minded people take revenge. Weak-minded people take revenge, and strong people will apologize, and brave people will forgive. I think this forgiveness is very important. We should not always try to take revenge, try to talk bad about others, and all these things. Why I am telling this? Friends occupy more space in the heart. Enemies occupy more space in the mind. So suppose you quarrel with somebody or you get into an argument with somebody. See, whole day you get disturbed actually. Whole day you get disturbed. And even if you try to forget, it keeps coming. That is the reason we should have more friends for a longevity and better. See, that's what. What is definition of life? Life should be simple in wealth, silent in anger, polite in authority. Simple in wealth and silent in anger, polite in authority. See, it's extremely difficult to be simplistic when you have a lot of comforts. We always go for comparison, never go for social, economic, and academic comparison. See, why can't you compare? Somebody is so simple, although they are rich, they are so simple, they are so humble. Rather than going to, many times people get disturbed after attending some fat marriages. Oh, the entire body was covered with gold. I mean, it's all diamonds. So you have to compare with some people who have contributed something to the society. So just because we wear a branded item, that doesn't increases your brand value. I think simplicity, because the money you can always measure, simplicity you cannot measure. I think simplicity is ultimate sophistication. Simplicity is ultimate sophistication. So I think of course, today we are getting into a lot of stress. I think this is an decade of stress, because children education has become mother's examination, and at the same time we are having stress of our leading a life. And another important thing, why is so much stress? See, one is, of course, we are all retired, but still you have a lot of other things to do. So while working, they have a different Academic people will have a different stress, and those who are having administration in hand, they have a different stress. I think head of the administrators have got highest level of stress, because I was the director of Jayadeva Institute for 18 years, and the amount, because you have to take the stress of the entire workforce. So probably that is the reason people think, no, he is the executive director, he is the chairman and managing director, he is general manager. In fact, maximum stress is for those people only. So you have to, because they have to take all insults. So stress is what? Is the difference between expectation and performance. If your expectations are too much, then you will be stressed. So I think this is where we have to make up our mind. Stress is considered to be a new tobacco. Stress is considered to be a new public health problem, and stress is considered to be a new smoking. Suppose if you just can check on yourself actually. Nowadays we have these BP apparatus, digital BP apparatus are there. See, if you are under stress, blood pressure which was 120 by 80 become 180 by 100. You quarrel, you get into an argument, check your blood pressure before getting into an argument. BP which was 130 by 80 become 200 by 100. When you are quarreling, when you are actually arguing, you can yourself feel there is shaking of hands. Your heartbeat is, you can appreciate your own heartbeat. Sometimes there can be sweating and all. So I think this is where, so you have to be silent on 3 occasions. Always people who are happy have 3 things in common. People who are successful have 3 things in common. One, they have patience, they have good temperament, and occasional silence and smile. So all these people will have common factors. Successful people are happy people. Because actually what happens, patience actually avoids problem, smile solves the problem. You may not be liking somebody. If somebody comes in front of you whom you don't like, just smile at them. Even without your liking also you smile, nothing will happen. Suppose if somebody comes and sits by the side of you whom you don't like, or who has really irritated you, who is talking bad about you, your heart rate goes up, your blood pressure goes up. I think we have to, that is the reason we say smile is the best cosmetic. Smile is the best jewelry. Smile is the best medicine. Smile is the soul of your beauty. So I think that's the reason I always keep telling you should smile 3 days a week. You should walk 3 days a week. You should talk to each other 3 days a week. And you should talk good about others 3 days a week. What are those 3 days? Today, yesterday, and tomorrow. Today, yesterday, and tomorrow. And I think another important thing, we have to learn how to excuse people. See, mistakes are basically for corrections. In my opinion, mistakes are basically for corrections, not for punishment. See, during my tenure, of course, it's a heart institute. The workforce, when I took over as the director, it was 440. When I left, it became 4,000. 4,000. And I literally coined 3 words and practiced them to perfection. What are those 3 slogans I introduced? Treatment first, payment next. Second is, first is treatment first, payment next. Second is life is more important than the file. Third is humanity is priority. During my tenure as a director of that institute, we have treated 75 lakh outpatients, conducted 8 lakh operations and procedures. Believe me, nobody has gone untreated for the want of money. Whether money, no money, documents, insurance, no insurance, they were all taken care of, because heart attack does not wait for all those procedures. Heart attack does not wait for all those formalities. That is the reason, of course, now still, although you are in a retired age group, some of them are still working, some of them are being advisors to some sector. So we have 2 books. One is rule book, another is humanitarian book. See, I think there are, even if there are wrong things in that rule book, if you follow wrong things in the rule book, you are correct. If you try to correct those wrong things and try to help the society, try to help the community, you are penalized, you are wrong. This is where India needs an amendment ministry. India needs an amendment ministry. I will just give an example. Why I am telling that? Because you are going to actually train some younger generation people, because 40,000 employees are young. See, actually, I will tell, most important, if you have a positive outlook, always you can certainly do, you can help the society, help the people. There are some people, they are extremely negative, they are sadistic, they are sarcastic, and they don't see why God has given one mouth and two ears. Because you should talk less, listen more. Talk less, listen more. So a listener is a good leader. Listener is a good leader. I think one of the real problem in our bureaucracy is happening. They are not ready to listen. No, they say you bring everything on single file, but that person has come to you to give the wedding invitation. So they don't even that. So I think you should have tremendous patience. Of course, we always say as doctor, you should have patience for patients, and you should all have patience for customers and patience for the community. This is very important. So another important thing, you should avoid impulsive behaviors. Impulsive behavior. See, there is a generation gap between us and our children and our grandchildren. There is a generation gap. What exactly they are doing, 80% we don't like them. The dress we don't like them, and their behavior we don't like them. We can't blame them. It is basically the age fact. I mean, and also the culture has changed. The way things they are looking at change. The global phenomenon. It's a global phenomenon. So one of the best thing to be happy at home is you can always give an advice. If they don't listen, don't persist with that. If you are persisting, then you will be in problem. See, probably when as we age, when we cross 70, 75 years and all, always our attitude becomes like a childish attitude. So even if they don't like, if somebody doesn't speak to you or at home, don't bother. So that we have to accept those things. Then we'll be more happier. And advice also, you can't go on giving too many advices. So on 3 occasions you have to be silent. When, number 1, when you don't have proper information about a particular thing, keep silent. Second, when you fully know whatever you tell, other person is not going to believe you, is not going to appreciate you, don't talk. Third is, when somebody knows everything about you, is an admirer of you, is a fan of you, no need to explain. You should go on doing good things, and there is no need to substantiate and justify that I am doing so much, I have done so much. So this is where we can, so we should always live to express. And we should work for a cause, not for applause. And you should work for a cause, not for applause. You should live to express, not to impress. And you have to, of course, after retirement, if you are respected in your society, if you are respected in your organization, if you are respected in your own group, that means you have done a wonderful job. That is the ultimate testimony to your job. That's how I have seen. See, during service, if you are holding a higher post, they will always, whether it is a respect or a pseudo respect, we don't know. Some people will think, he's a cranky fellow, wait to have all those problems, let us wish him this thing and that. After retirement, if you are highly respected, that is the best award that you are getting. Then, yes, I'm just trying to, impulsive behavior is one thing we should have, because why I'm telling that, during that 18 years as director, I had never given a memo to any of the employees. I had never given a memo. But what I have done, I have signed, I have kept the memo tight, but I did not sign. That itself was some sort of a vigilance on them. So this is where, if you salute your work, there is no need to salute anybody. If we pollute your work, then we have to salute a lot of people. So this is it. So I think these are some of the general things. Another important thing is life. You have to move on. There's a difference between aging and life. What is aging? Aging, is it a number? Aging is number of years you have not spent with the loved ones. That is, during our service it has happened. Aging is number of years not spent with your loved ones. But life is the moments you have spent with the loved ones. So I think now aging, yes, it is happening, and now you have got a tremendous. So who are your the stress busters? Is your grandchildren or your own children, grandchildren or your this thing? See, another important thing, why stress levels in the community is going up nowadays in India? Today stress is extremely common. I will come back to that a little later. Because the joint families are the backbone of Indian culture. Joint families was the stress buster, the shock absorbers of our social culture. Today joint families are breaking away. Earlier, in one house there used to be 15 people, 20 people, and each one was taking care of their different problems. And house itself used to be a kindergarten school, or whatever it is called, preschool nowadays. Or it could be a counseling center. House itself was a community center. And now, I think these are big. As a result, now, what is the definition of joint family in 2026? Definition of joint family in 2026 is husband and wife living together is joint family. Both are working, and each one is passing the stress to the other. There is a child in between. Child is sandwiched between these parents, and we are putting children into the buses as animals in the early morning to get them to the school in big metro cities. And actually stress levels are built, we are building up a stress level for a very young age. See, nowadays you look at IT/BT people, they are so stressful, they are working late into the night. I have seen when actually father and son walks into my chamber. Although I am a member of the parliament, still I practice cardiology 2 days a week. 2 days a week. I practice cardiology 2 days a week. Today only I saw about 23 patients. I gave consultation to 23 patients. So still you can find a time. So mine is some sort of a hybrid role. I am whenever I am in Bangalore, I practice 2 days a week, Monday and Wednesday, between 12 to 6. Then rest of the 5 days we will take care of constituency works and all those things. See, I think the stress management is extremely important, because otherwise we will be lost. So stress, as already said, is considered to be a new tobacco. Yes, some of the problems, health problems, because you might be wondering, this doctor and this he is only talking about life and talking about longevity and the lifespan and those things. Today 60% of deaths in India, 60% of deaths in India is due to lifestyle driven diseases. What are those diseases? 60%. One is heart attack and heart related complications. Second is high blood pressure. Third is brain stroke. Fourth is cancer. Fifth is diabetes mellitus. Sixth one is added to this list of lifestyle disease, what is called screen addiction and loneliness. Screen addiction and loneliness, I think now in many forums and many functions, when you go for a meeting, when you go for some actually functions, I have seen they are actually searching for mobile phone, but they are not searching for the children they have lost. The children have disappeared somewhere there. So they are not interested to find out where is my child. They are interested to find out where is my mobile. So I think these 60 to 65%, how the landscape of diseases has changed. We are all lucky. I think we have to thank God every day. We are going to sleep and getting up next day morning. We are going to sleep and getting up next day morning. We should be thankful to our parents. We should be thankful to the God. We should be thankful to our own self, because God has given some life and still it is going on. That is very important. Today, landscape of all these diseases has changed totally. See, earlier children used to bring parents for the treatment of all these diseases: heart attack, brain stroke, cancer, diabetes. Today, what is happening? Parents are bringing their children in the age group of 25 to 40 for treatment of heart attack. 30% of deaths in India is due to heart attack and brain stroke. 30%. Among these, nearly 35% of heart attack is below 40 years of age. Many are potential bridegrooms. See, earlier, of course, even now we practice before getting our daughter married, we always try to check the horoscope of the bridegroom. Now time has come, we have to check the health horoscope of the bridegroom. We have treated bridegrooms who have come from wedding hall itself. Believe me, it's an arranged marriage. Both have liked each other. So I think this is, so why all this is happening? Why all this? Why our younger generations are becoming more susceptible to all these lifestyle diseases? Probably you are a great example to all children, because your lifestyle they have to follow, and your food habits they have to follow, your food products they have to follow. Nowadays, all these are being attracted towards fast food. What is the definition of fast food? The food takes away your life very fast is the fast food. That is the fast food. So, we are trying to look at all these things. We have modifiable risk factors, non-modifiable risk factors. Of course, I will also come to some of the diseases which are very specific to elderly people. So let me give focus on younger generation people. So we have non-modifiable risk factors. We can't change them. Age you can't change. Age you can change only on the marks, on documents, I think, but your biological age you can't change. When I was a medical student, age more than 65 was an independent risk factor for heart attack, age itself. Now age more than 40 itself is a risk factor. Then females, earlier, before 50 years of age, heart attack was very rare. Now in our study, study group of young heart attack, 10% of young heart attack were females. 26-year-old doctor, lady doctor, 29-year-old software engineer, and 19-year-old laborer. So that hormonal effect is going off, because it was true also that this female hormones was giving protection against heart attack. Nowadays what is happening? Women also work like men, exactly, except for the reproductive cycles. They also work like men. That is the new nomenclature has emerged, what is called menish women. They are called menish women. They exactly work like men. And another important thing, all problems of the family are deposited in a bank called women. See, she has to take care of child, take care of husband, take care of the family, she has to attend to work and all. So today, that's the reason I said children education has become mother's examination. Age you can't change, and sex you can't change. Of course, now some new robotic surgeries have come, can change the sex. That's a different issue. Then family history. In our study, 18% of those young heart attack patients have a strong family history. Suppose in a family, if somebody has suffered an heart attack before the age of 50, such family members are more prone for heart attacks. If somebody develops a heart attack at the age of 80, it is not a family risk factor. If younger member of the family have suffered an heart attack, that becomes a risk factor. Such families, I have seen a blockage in the father is in a particular artery. Even the son, when he develops a heart attack, in the same segment, he develops a blockage. That is the beauty of genetics. That is the beauty of genetics. So these you can't change. Age you can't change. Sex for all practical purpose you can't change. And parents you cannot change. Families you can't change. So these are the non-modifiable risk factors. What are the modifiable risk factors? Smoking. Unquestionably, smoking is number one cause for heart attack and brain stroke. Some people argue, what doctor you are telling? My neighbor is smoking 20 cigarettes a day. He is 75 years. Kalgundidangidare sir, Aramagidare. He is fine. But those are all rare examples. We have seen in Discovery Channel, somebody falls from 14th floor, survives miraculously. If all falls from 14th floor, they will not survive. So smoking is an important, it's a reversible, you can always. Then alcohol. See, alcohol, there are two theories. Of course, India is, many states are thriving on alcohol because alcohol has become actually a major source of revenue in many states. So 60% of alcohol consumption occurs in South India. 40%, in that way I think North India is better, 40% consumes in North India. Alcohol in small doses, okay, it has no adverse effect on the heart. But as doctors, we can't give alcohol as a prescription. Because suppose if I tell, okay, alcohol in small doses can be taken, what patients remember or what people remember, doctor did say alcohol could be taken, but they conveniently forget the dose doctor has mentioned. Some people say, no doctor, we take alcohol on occasions. Wife says, sir, for him every day is an occasion. And alcohol, just to make it more humorous, alcohol is a device which converts silence into speech. Some people, when they take alcohol, start speaking different languages. And just in the later vein again, please don't mistake me, wife is also another device who converts speech into silence. So I think let apart. Certainly alcohol is bad. Alcohol increases blood pressure. It increases the incidence of heart attack and brain stroke. Then physical inactivity. This is one of the problems. According to one study, 51% of Indians are lazy today. There is robust data. If you walk at least 45 minutes a day, it increases your lifespan by nearly 10 years. Even heart also says, you just walk 1 hour for me, I will continue to beat for rest of your life. That's what the heart says. If you walk 1 hour for me, I will continue to beat. So smoking, these are reversible cause, risk factor, diabetes. India, 14 crores are having diabetes. Another 14 crores are on the verge of becoming diabetic, pre-diabetic. All put together is almost 28 crores. So diabetics are more prone for heart attack and brain stroke. High blood pressure. Nearly 22 crores Indians are having high blood pressure. There are two types of blood pressure. At home, BP is normal. When they come to the doctor, it becomes high. That is called white coat high blood pressure because we wear white coat. But it's also a blood pressure. But another type of high blood pressure is masked high blood pressure. That means BP recorded at home is very high. BP recorded at home is high, When they come to the hospital, it is normal. That means there is some problem at home. There is some heater at home. So that they have to take care of. So another important cause, physical inactivity. This is a real problem for various reasons. A lot of Indians, this thing. Then breaking away of joint families have told all those things. And cholesterol. I think today I think this WhatsApp University has created a lot of problems for this WhatsApp University has created a lot of confusion among the public. You can eat anything, nothing will happen. There is no relationship between cholesterol and heart attack. That is not correct. So today, and one important thing, the common man perception is cholesterol will be high in only those people who are overweight or those who are obese. No, even a thin individual, those lean individual or low weight individual also can have high cholesterol. 70% of cholesterol is synthesized in your own body. Only 30% is dependent on what you consume. So there is no, just because you are lean, just because you are underweight, that doesn't mean cholesterol is normal, this thing. So another two important risk factors that have emerged is air pollution. Air pollution today kills more people than smoking. Air pollution is considered to be a new tobacco because particulate matter less than 2. This is a new risk factor that is emerging nowadays. They may not be smoker, they may not be diabetic, they may not be having high blood pressure, but still 25% fit and fine, they develop heart attack. So these are some of the reasons. One is reverse stress, second is air pollution, because pollution goes down the lungs into the bloodstream, can cause blood clotting and all. So these are some of the important things. Then I just wanted to highlight about these symptoms of heart attack. Not everybody will get left-sided chest pain. All the more in elderly people, in 25% who develop heart attack, they may not get chest pain at all. It could be burning sensation in the mid region, or it could be burning sensation in the stomach region with vomiting, sweating. It mimics gastritis, or it can mimic a hyperacidity. Many people have succumbed ignoring this heart attack symptom for acidity. They are confused. So this is the real problem with the educated people. Illiterates, they don't know. I think there is some problem, they go to the doctor. These so-called intellectuals, no, it is acidity. I have taken some spicy food. No, I have taken some drink last night. I have eaten some fried foods. That is the reason. So burning sensation can also be a symptom of heart attack. And gastritis is many a time heart attack is confused for gastritis. And some people see what is heart attack? When an artery is 100% blocked, that results in heart attack. If it is 70%, if it is 80%, these are the people when they walk uphill, while walking, climbing, that too after taking food, if they are walking uphill or walking, climbing, at that time if they get chest pain, or if they get burning sensation in the chest, or if they get some shoulder pain, or if they get some throat pain, or sometimes jaw pain also sometimes can come. Most important, if the blockage is more than 70%, then they get all these symptoms. Not necessarily it should be left-sided chest pain, but most important is some people get chest pain at rest. While walking, they are absolutely comfortable. That is not from the heart. Some people have shoulder pain always because heart is on the left side. Left shoulder pain, a lot of people come. Left hand pain, they come. Some people say, doctor, I am having a lot of hand pain at rest. While walking, I am absolutely comfortable. Then it is not from the heart. So other way around, at rest I am fine. While walking, I get shoulder pain. While walking or climbing stairs, I am getting burning sensation in the mid region or stomach region. Most important, heart pain always related to walking or exertion. That is the reason we advise people to walk. Number one, it's a good exercise. And even climbing stairs also. Just because you are 60, 65, 70, if your knees are strong, you should still climb stairs because it's a very good exercise. And if there are any problems in the heart, you will come to know while climbing stairs. So that is the reason these are some of the sometimes when they get heart attack, they may not get pain in the front of the chest, they get in the upper back, because there is one artery which goes on behind the heart. Two arteries go in front of the heart. The third one goes behind the heart. If that artery behind the block is the culprit for heart attack, you get left upper back pain. These are some of the. And silent heart attack is common among elderly people who are diabetic after the age of 75, 80. They may not get any chest pain at all. Sudden onset of breathing difficulties, tiredness, fatigue. These are some of the important things you should always know. And most important, heart attack treatment should be within the golden hour. Those who get treatment within the first 1 or 2 hours, they always get a very good result. Survival rate is very high. I will not get into the technicality of all those things. And when somebody suffer from an heart attack, undergone an angioplasty or a stent, undergone a bypass surgery, 2-3 medicines to be taken lifelong. That is blood thinners, aspirin, and cholesterol lowering drug to be lifelong. I think our people, that too, some so-called knowledgeable people, they check cholesterol level. If it is normal, they stop. It has become normal because of medication. Same thing also happens for high blood pressure. Many people will not come for mastoral checkup or regular checkup thinking that if by chance if I have got high blood pressure, by chance if I have got an heart problem, by chance if I have got a kidney problem, they don't come. It's also other way around. Suppose by chance if you don't have anything, then it's an health promotion. That itself will be reassurance. And some people today only somebody was asking his blood pressure was 200 by 120. Doctor, if I start taking tablet, I have to take lifelong, no? Why to take it? No. Because first few years of onset of diabetes, first few years of onset of your high blood pressure, you may not get any symptoms. But when they develop complication, they will be disastrous. High blood pressure, if you don't take medicines properly, because 50% of people with high blood pressure do not take medicines properly. They think that why to take. I think they give their own explanation. I was yesterday quarreled with somebody. I was under stress. There was some business loss, something like that. Because untreated high blood pressure can give rise to complications like stroke, that is paralysis. You imagine a patient of paralysis. He is bedridden, is a misery for the family and misery for himself. So untreated high blood pressure can give rise to brain stroke, heart attack, kidney failure, and even eye complications. So that is the reason. What is the normal blood pressure? It is about up to 130 by 90 or up to 140 by 90. Just because one reading is very high, we don't immediately treat. Suppose your reading is 150, 100 and next 3 readings are 138, we always put them on weight reduction, salt restriction, like that. That's how, so this is how we have to treat this blood pressure. So is it possible to know whether I am going to develop blockages? Is it possible to predict heart attack? That is the question actually. So nowadays we do what is called treadmill ECG. Because just I will give an example. One person gets chest pain on walking 1 kilometer. At rest is comfortable. So if you take an ECG at rest, it will be normal because it doesn't have symptoms. So make him walk 1 kilometer, take ECG, then that ECG will be showing changes, then we do angiogram. Nowadays, just because your ECG is normal, that doesn't mean your heart is normal. So of course we do echo, all those under master health checkup. In fact, we have been doing this master health checkup for Kendra Bank employees at a subsidized rate of 1,500. Even in this Bangalore hospital where I am going, there also we are, I think 2 weeks back we entered an MOU. So this master health checkup includes everything: blood sugar, blood cholesterol, kidney function, liver functions, and hemoglobin, ECG, echo, treadmill, everything. So I think just this example, somebody is getting chest pain and walking 1 kilometer. If you take only ECG, it will be normal. So you have to make him run and take ECG. And now we have some other investigations. We always look at calcium deposition in the arteries on CT scan. If there is a calcium deposition in the arteries, you may not be having symptom. If there is a calcium deposition in the arteries on the CT scan, then that means the disease process has already started. We have to take precaution. That doesn't mean, so these are some of the things we have to do that. See, we all celebrate birthdays. We all celebrate wedding anniversary. Because burden of all these diseases is very high in India, that too among this young and middle-aged population, we should have what is called medical checkup anniversary. Medical checkup anniversary. So, and you should avoid 6S or 5S or 6S. Not avoid, some you should avoid and some you have to restrict. What are those? Salt, stress, spirit, smoking, sedentary activities, and sugar. In fact, sugar is worse than cholesterol. I think these are some of the precautions you should take. And other things, for blood pressure, we give some medicines. And those who are on blood pressure, when they stand, if there is giddiness, that too, if there is a giddiness, you should be careful when you are going to the restroom. There you can fall, you get injured, you can bang your head against the taps, or you can bang your head against the wash basin. I think it's very fair. That's the reason. Suppose if you are on medication for high blood pressure, when you are sitting for a long time, when you stand, when there is some giddiness, you immediately should not move. Just stand for about 30 seconds, then it normalizes everything, then you can move. And you should tell the doctor, sir, when I am standing, there is some giddiness. Then we have to check the blood pressure, both sitting and standing. Many times it has happened, blood pressure is normal at sitting. When they stand, blood pressure falls, and those are the people, they fall down. So I think these falls are very common among elderly people. One is because of this medication, and diabetes can also have a fall because of autonomic dysfunction. And another important thing, not only elderly people, everybody should avoid talking to mobile phone we are coming down the stairs. This is one of the common thing we overstep. Either you will sustain a fracture, and a lot of youngsters are having ankle injury, ligament injury, because they are looking into the mobile phone, and they are talking to the mobile phone, and at the same time they are coming down the stairs, and these are some of the precautions you should this thing. And those who are taking some medicines for heart failure, when the heart function is low, and particularly for some patients of high blood pressure, we give some diuretic medicine. It can cause low sodium level. When sodium level is low, they can have giddiness, they can have drowsiness, they become unconscious. These are some of the important things. Of course, arthritis is pretty common. That is the reason when you are young, when you are in the middle age, you should walk actually. Then all those things is very important. So for a healthy heart, keep 5 things as low as possible. For a healthy heart, keep 5 things as low as possible. So what are those 5 things? One is blood pressure, second is blood sugar, third is cholesterol, fourth is waist circumference and body weight. Fifth, very, very important, is over ambition and over expectation. I think keep all these 5 things as low as possible, then we will have a very good health. And there are about 1 dozen medicines in this world. Non-medicine, they are not medicines, but they act like medicine. What are those? One is sunlight, second is diet, third is exercise, Fourth is intermittent rest. Fifth is intermittent fasting. And sixth is smile. And seventh is friendship. Eighth is fruits and vegetables. And ninth is talking to each other than talking about others. And 10th is having dinner with family members. And 11th is meditation. And 12th is yoga. I think these are non-medicine medicines because they are not in injection bottles, they are not in syringes, everything is free, and these things are very important. And most important, calmness is very important. See, we have got many degrees. I think most important degree is calmness, because I agree knowledge is power, but actually character gives a lot of respect. So knowledge, this thing. And most important, these are some of the important health tips one can give. Certainly, Kendra Bank is one of our favorite bank. As far as I am concerned, we have bank account in Kendra Bank. And we have done a lot of projects with under CSR from Kendra Bank. I think at that time, one chairman and managing director was MB and Rao. Then another one was Dubey, I think, chairman and managing director, R.K. Dubey. So I think if you want to live longer, you should go on helping people. If you want to live longer, you should go on helping people. And certainly one cannot help everyone, but everyone can help someone. So one cannot help everyone cannot help one. So avoid three things are also, because it's a fast moving world. So I think hurry, worry and curry are also causing a lot of problems. So you should not be in a hurry, okay? You should not be worried. I think stress is one thing we should try to avoid, and try to correct people. Try to correct the people. If you are not able to correct people, you correct yourself. I think no point. You tell something to your grandson or child, you have to do whatever you are doing wrong. If they insist, no, whatever I am doing is correct, means it's fine. I think it's fine, carry on. You have to do this. That's the reason stress causes wrinkles on the face, happiness causes pimples on the face. So this is how I have some commandments for this younger generation for a successful career. Those are about 8 to 10 commandments I have made myself. Dedication is more important than designation. Sincerity is more important than seniority. Values are more important than valuables. Mindset is more important than the marks. Efforts are more important than the results. Loyalty is more important than royalty. Progress is more important than perfection. And decisions are more important than dialogues. Finally, proper work is more important than paperwork. Thank you very much.